They had a man on the street asking men, do you know where your prostate is? Now, this is deep. This is deep, Landi. Dr. Kim said in his experience working with patients with prostate cancer, about 30% of men that he consults with don't know where their prostate is. About 50% don't know what the function of the prostate is. And yet it's the most common cancer affecting all men.
Because unfortunately, specifically with this disease, most men don't learn about their prostates until they have prostate cancer. They didn't know much about it. I think my father was like the one who said that. I knew I should get it checked, but I didn't know why. I just know, okay, well, if you're doing my physical, just go ahead and check that too. You not knowing about this part of your body and your doctor not recommending you get tested for it means that you could have prostate cancer and not find out until it's stage 3 or 4. And now it's aggressive. You'll probably have to have your prostate removed. You have to hope it hasn't spread to or metastasized to other areas of your body. Whereas if you knew enough about your own prostate, you could ask your doctor for these tests, whether they're recommended or not. And then you can know, okay, this is my baseline. Now I know I need to get checked annually because my blood test is showing my PSA, which stands for prostate specific antigen, is a little high. And I need to check it to see if it's progressing, because now we can catch it early. And when you catch it early, you can survive this and you can be back to normal.
And it's not just awareness of the disease itself, it's awareness of prostate health.
Totally. And honestly, I mean, since you watched the movie, we can joke about this. Most men don't realize what it takes to have a healthy prostate they would actually enjoy.
This is Genetics for Healthcare, a podcast for patients.
Welcome to another episode of Genetics for Healthcare, a podcast dedicated to helping patients and their caregivers advocate for a precision medicine approach to treatment, disease screening, and prevention. You can find us on Spotify, Apple Podcasts, YouTube, LinkedIn, Facebook. Check out our shorts. Also Instagram. Hit that subscribe button on YouTube to get alerts and updates on new episodes like this one. Today, I am honored to have Landi Maduro, CEO of Blue Child Entertainment, founder and president of Women of Color Filmmakers, and I met her through a screening of her film, The Silent Killer, Prostate Cancer in the African American Community. Landi, thank you so much for being a guest on our podcast.
Thank you for having me. Thank you so much.
So we've been chatting it up here, and just to give our listeners, some background, we met at a community awareness event. Right. It's called Brother to Brother. And we support all of these nonprofits or patient advocacy groups. We want people to know where they are, when they're happening. And this is one of the first that I've gone to in a long time. Very robust response from the community. And you were there.
Yes.
First, tell us a little bit about like your path to being a filmmaker. Like, what inspired that? And then specifically, what led you to producing or developing this film about prostate cancer, obviously a disease that men are going to experience or are likely to experience?
Sure. Yes. So I always wanted to be in entertainment. Even when I was a kid, I used to put on little shows with my stuffed animals and just, I always wanted to be in entertainment. And so I started as a model and an actress. But I hated trying to maintain a size 0, which was required at the time when I was modeling. The Kate Moss look was in, so I'm kind of telling my age. And it was just hard to maintain that. I just wasn't that. And then my acting, I hated auditioning, which is counterintuitive to booking an acting job. So I always knew I wanted to work in entertainment. I worked professionally as a singer and toured, but that was hard because I had a child, and being gone from him for long periods of time was hard. So I decided to go to photography school. And, when you're a actress turned photographer, you're doing all your friends' headshots, right? So I would do a lot of headshots and things of that nature.
I'm sure they appreciate that.
Right, exactly. And I knew how to help them, as an actor. And so going from there, I started getting requests when I would pick up corporate gigs, and they would ask, could you do video also? And I was like, I don't know if I could do video. Like, I'm a photographer. And I started kind of practicing a little bit. My friend of mine said I could do it. And matter of fact, I had hired a videographer who didn't show up. They showed up an hour and a half late to a corporate event, and I was freaking out. So I had to learn on the fly how to do it. And after that, I realized I can do this, and I could get back into acting by doing my own films and projects, right? That I didn't have to audition for. I could do them myself. And so I was hired to do headshots at a film event. And I heard this gentleman on stage talking about how he was making all this money making horrible films. He knew they were horrible. Like, I'm not calling them. He said, these are horrible films. But he had found a niche where he was making all this money in foreign markets with his horrible movies. And I was like, if he could do that, there's no reason why I can't do that. And so I kind of started getting into the producing side, did my first short film, wrote it and produced it, and it did well on the film festival circuit. And then I got the bug for directing and producing, and then the opportunity came to do The Silent Killer. And that came from a friend of mine. His father and brother had prostate cancer. And so he knew he was high risk being African American, but he was like, my doctor tells me I'm high risk, but nobody's talking about this. And I was like, really? Yeah, I haven't heard anyone say anything about prostate cancer either. And so he brought me the idea. He was like, I want to do a movie, but let's go to like churches and sporting events and just have discussions about prostate cancer. And I was like, well, first of all, I don't know any man that wants to talk about their prostate. So I feel like I think it's a good idea to have the discussions, but we need to follow, men who are dealing with prostate cancer and get their stories and hear and watch their journey, and maybe have someone take us on this journey as they learn. So that was the approach we went with. And we did a lot of research, and about 6 months in, working on the film and doing research, my dad was diagnosed with stage 1 prostate cancer.
Wow.
And so he agreed to be in the film and share his story as well. Yeah.
Oh. So a lot of things to unpack there. And I want to get into the learnings of the process of you making the film. And as I mentioned, we met at an event, brother to brother. I got to give a shout out because I live in the city of Dallas, and I got to give a shout out to these community partners who helped put on this event: the South Dallas Fair Park Faith Coalition, UT Southwestern, and Light of the World Church of Christ. Just some statistics on prostate cancer, because as you mentioned, brothers don't want to talk about their prostate. What's interesting in that is that prostate cancer is the most common cancer in men. The American Cancer Society predicts that in 2025, over 313,000 men will be diagnosed with prostate cancer. Mm-hmm. Brothers, men, you got to start talking about the prostates, okay? Black men are almost a twofold, depending on where you get statistics. The resource, almost a twofold risk of developing prostate cancer in their lifetime. And the challenging thing is that this is a tumor that grows that may have no symptoms for a number of years. And it's the second leading cause of cancer deaths in men, with over 34,000 men every year that die from the disease. Mm-hmm. To your point of why people don't want to talk about this, and I'll get to the learnings here, or at least what I learned. I would love to see your perspective as a producer. One of the urologists in your film, Dr. Frank Kim, mm-hmm. there was so first of all, you got to go watch the film. It's on Tubi now. You can tell us more about it. That's where I watched it. But one of the clips, they had a man on the street asking men, do you know where your prostate is? Mm-hmm. Now, this is deep, Landi. Mm-hmm. Dr. Kim said in his experience working with patients with prostate cancer, about 30% of men that he consults with don't know where their prostate is. About 50% don't know what the function of the prostate is, and yet it's the most common cancer affecting all men.
Yes. Yeah.
How does this lack of awareness and understanding, How did that affect the men that you interviewed in the film?
It was big. It was huge because, unfortunately, specifically with this disease, most men don't learn about their prostates until they have prostate cancer. And so a lot of them, even admitted that to us. Like, they didn't know much about it. I think my father was like the one who said that. I knew I should get it checked, but I didn't know why. I just knew, okay, well, if you're doing my physical, just go ahead and check that too. And the problem in that is with the way that, healthcare in the United States has been, the health task force had ruled against checking men at around 40 to 50 for prostate cancer, doing the digital rectal exam or doing even a PSA blood test. And the problem in that is most African American men were getting prostate cancer at younger ages with more aggressive forms of disease. So you not knowing about this part of your body and your doctor not recommending you get tested for it means that you could have prostate cancer and not find out until it's stage 3 or 4. And now it's aggressive. You'll probably have to have your prostate removed. You have to hope it hasn't spread to or metastasized to other areas of your body. Whereas if you knew enough about your own prostate, you could ask your doctor for these tests, whether they're recommended or not. And then you can know, okay, this is my baseline. Now I know I need to get checked annually because my blood test is showing my PSA, which stands for prostate specific antigen, is a little high. And I need to check it to see if it's progressing because now we can catch it early. And when you catch it early, you can survive this and you can be back to normal. And so not knowing about your prostate is definitely dangerous because you cannot, and I cannot stress enough, you cannot be beholden to your doctor to tell you everything about your health. You have to take control of your health as well.
Yeah. And it's not just, awareness of the disease itself. It's awareness of prostate health.
Yes. Totally. And honestly, I mean, since you watched the movie, we can joke about this. Most men don't realize what it takes to have a healthy prostate. They would actually enjoy. You know what I mean?
Yeah, listen, Landi, this is what's interesting. So, I've been in this field of cancer research, diagnostics, what we call precision medicine, and I am now a man of a certain age. And as I started to have this conversation more around the podcast and the work that I'm doing to draw increased patient awareness and advocate for our health, as I started talking to my circle, men who are around my age, all of a sudden I felt like I was in a room full of people that I didn't know were there. Right? As I'm talking to people, there's like, well, I had a bout of prostate cancer. Oh, well, I was diagnosed last year. A guy that I know and was talking to, he also has a podcast. He's being treated for prostate cancer. And so as I just started, getting anxious, like, oh my gosh, it was all around me and just really didn't realize it. So that awareness and being able to share those stories are what's important. One of the stories in the film, he was a judge by the name of Dwayne. His father had died of prostate cancer. And at the time that you interviewed him in this film, he hadn't been to the doctor in about 10 years, he says. Mm-hmm. And as he was diagnosed, the impact on his life was not just his health. And in fact, he said it was never the tumor itself that caused him issues. It was the effects of the cancer treatments and other ramifications, the ripples that it caused in his life, the insomnia and the depression, the side effects from the surgery, radiation, drugs, hot flashes, impotence. And it even had a financial impact on his life. What did you find about, how the men, I guess, manage going through treatment? And, what was kind of the takeaways that they wanted people watching them in the film that they wanted people to know?
I think the biggest takeaway that most of them wanted to get out is that not talking about it is selfish. Mm-hmm. You're doing a disservice to your family because it is a genetic disease. A lot of the men who are diagnosed with it in our film, they had a family history of prostate cancer that was not always talked about. And so, we know granddaddy died of something, but we don't know what. Or just how you mentioned, you had several friends who are dealing with prostate cancer or had it or in treatment, and no one's talking about it. And it becomes very dangerous not talking about it within your family, because your sons are susceptible to prostate cancer if you are diagnosed. And the biggest issue I know for Dwayne was feeling like he didn't have anyone like that support, because him and his wife got divorced, and dealing with it by himself. And unfortunately, some men, they feel like they want to deal with it by themselves, but we found that the men who had support systems were able to get through it so much easier. They were able to have someone to go to the doctor with them when their brain becomes foggy because all they hear is cancer, but there's another person who's taking notes and asking questions, and then they can go back and talk about it when they can kind of just let the diagnosis settle in, and now let's figure out what's our plan of attack. And so I think the biggest thing is sharing with your family members if you're diagnosed, knowing that you don't have to go to your doctor appointments by yourself, and that you're not less of a man because you've been diagnosed with prostate cancer and you now may have to have some treatment.
Yeah, absolutely. Regarding the financial impact, lack of health insurance is a major factor with men not going to the doctor and being checked. But even that, it's great to be aware of your family history, as you mentioned. And I talk about this a lot. And I haven't found this to be specific to the Black community in the United States. But as you mentioned, Uncle Jones died of something. We don't really know.
Right.
Grandma died, but back then they didn't talk about like cancer diagnosis. They didn't even want to say the C word, right? So a lot of times, something happened or a family member died and we just did not know. But if you know your family history, at least you can start the conversation, or at least research for yourself on how you can take better care and reduce those risks. Even in a state like Texas, which is one of the most uninsured states in the country, and it becomes a real problem with increasing cancer disparities.
Totally. And I want to add two things to what you just said. One, the beautiful thing about where we are now when it comes to prostate cancer is if you are diagnosed, there's so many programs that will help you, even if you don't have insurance. I mean, the event that I met you at, right? They were doing on-site testing, and then they weren't just testing men and say, oops, okay, if you're diagnosed, good luck, right? Go see your healthcare provider. They were like, okay, if you're diagnosed, let's see how we can help you and see what programs we can get you into. So there's so much available to you now that wasn't available previously, especially when we shot the movie, because it took us 6 years to make the movie. It came out right around the time of Obamacare. The movie came out in 2017. So we were dealing with Obamacare. And so people were now starting to have insurance that never were able to have it before. So now, with the progression of time, there are programs. The other thing I want to mention, because you talked about family history, is genetics. And because genetics is kind of a newer thing as far as genetic testing and screening, again, that's not in the movie. But we have found that genetic testing can also let you know if you're susceptible. And this is where the problem comes in when we're not talking about being diagnosed, because if you're diagnosed and, like for example, my family, since my father was diagnosed with prostate cancer and unfortunately now pancreatic cancer, they told us we should be genetic tested, because clearly there's a strong history of cancer in my father's side of the family. His brother passed away from cancer. His father had cancer. They're like, we need to do some genetic testing. So that way, where you stand. Turns out my dad has something called Lynch syndrome, which made him susceptible to these cancers. And then me and my sister got tested. So now we know where we stand in regards to that and can make decisions for our health based on the understanding of our genetics. And, unfortunately, a lot of African Americans are not into genetic testing. They're like, and rightfully so. History has not been kind in regards to some of that. But making sure you have the right healthcare provider that you feel has your health and your best interest at heart, that's the person that you trust to get those type of testing done.
100% spot on. And that's the reason we have this podcast, Genetics for Healthcare. It's a podcast for patients and their family members, because when someone gets a diagnosis of cancer, the entire family and those closest to them get that diagnosis as well. It impacts and ripples. And as you mentioned, there's a lot of new genetic and genomic tests that are available that can inform your care. You mentioned germline genetic testing. There is a test for Lynch syndrome, but there's also germline multi-gene testing where you can assess a broader range of genes. And that can tell you, implications for early cancer screenings. If you have certain genes that make you of higher risk of developing disease, your health plan may pay for more extensive and frequent health screening. Also, it's good to inform, as you just mentioned, in real life, situation, your family, to talk about it with your family to mitigate risk of developing diseases. Even on the genomic or somatic side, and that's actually testing the tumor cells themselves to see how they're expressing. Genomic tests can inform therapy or clinical trials. There are genomic prostate scores that can inform how aggressive a disease might be. And, more recently, there are tests that are called minimal residual disease testing, or MRD testing, that can monitor the circulating tumor DNA after treatment to inform prognosis, treatment options, and a risk of recurrence. You can find that information on the American Cancer Society or a number of websites that are patient advocacy and informational sites for prostate cancer health. But I want to get into this. We talked about the psychological impact, all right? And there's so many different complexities to this, Landi. When you're talking about a patient's emotional well-being versus the psychological aspects of denial, all right? Not being willing to be tested versus the impact, as you said, not talking about it, not going to the doctor, being tested, can be selfish. And that was stated in the film. Talk to us about that's a deep thing, because it's not without warrant. It is well documented how the medical system has done experiments on the Black community, but specifically this film, The Silent Killer, Prostate Cancer in the African American Community, was examining the mindset and impact of the disease on Black men. And as we went through the film, you followed groups of men who had that mindset where they don't trust their physicians, or they don't understand, or they've had bad experience where the doctor talks over their head, or there's just not a good rapport with that particular doctor. Talk about how even having these conversations either impacted or did not impact some of those men to go to the doctor and get checked or tested.
I think, one of the things that we really discovered when we were traveling and talking to these men is how much power and this is definitely, I think a lot of people do this, but we see it a lot in the African American community, how much power we give our physicians. Like, we somehow forget that they're human, that they practice medicine, right? They have a medical practice, meaning they have come to surmise that a specific treatment works for this diagnosis based on the information they've had through doing it other times and through research from other scientists and things of that nature. And so we give them all this power and forget that the power that we have ourselves to advocate for our health. And so a huge part of what we've been doing, what we did with the film, and even now, why I'm a filmmaker, but I continue to go out and talk and advocate, and I'm on all these boards and coalitions because I want people to start advocating for their health. I'll tell you, just from a personal note, my father would not still be here if I had not basically, I don't want to say forced him to advocate for his health, but he had a daughter who was not taking no for an answer, or not
Wow.
taking, accept your diagnosis and live the rest of your life to the best of your ability. That was not a good answer to me. I was like, there has to be more that we can do. And I wasn't happy with what I was being told. So I told my dad, we need to do more research, or we need to find other doctors. You have the right to a second opinion. A good doctor will tell you, get a second opinion, right? A
Yeah.
good doctor will tell you, this is what we see right now, but if you have any further questions, let's talk it out. Or if you ask for a study or a test because you feel like the results you're getting are inconclusive, they're willing to do that. And if you're not getting that support, then yes, that's not the right doctor for you. Doesn't mean they're not a good doctor. They're not the right doctor for you.
Yes.
And I think sometimes we're so quick to think, the stereotype is, especially now post-COVID, doctors want you in and out. They just want your money. And then they want you, but some of that is the pressure that the doctors themselves receive because they're not being paid very much. And, there's so much, that's a whole nother, story in itself.
Yes.
But I want us to get out of this mindset that the doctor tells us something and we just go with it. We have to start to advocate for ourselves, to ask questions, to do our own research. If you're not someone who likes taking a ton of medication, then ask about other holistic things. My father found that they were trying to do chemotherapy on him. It didn't work for him. Chemotherapy, all it did was make him sick, wasn't affecting his tumors. Immunotherapy saved his life. But that took us leaving those doom and gloom doctors and going somewhere else.
Even the way, and you've been telling us about your father's, prostate cancer diagnosis, which is the irony there is just real spooky, that you were producing a film about prostate cancer and your father gets diagnosed with prostate cancer. But I also learned that in the midst of that, while he found a doctor that was for him, that doctor recommended a scan, and that's how they found the prostate or the pancreatic cancer. Tell us about that whole impact on not just your father's health, but your family, how it impacted your family.
I will tell you, the pancreatic cancer diagnosis was devastating. That felt like a gut punch. I felt like with the prostate cancer, I think because I'd been doing so much research, I knew it was caught really early. He had stage 1. I knew what all that meant. I knew that my dad had options. He could either choose to have surgery. He had a very low grade prostate cancer. So the doctor was really just offering active surveillance. And I think that's the other thing people don't realize. If you catch it early, you have options. And so he had options. And so he chose active surveillance because his prostate cancer was so slow growing. Yeah. In all honesty, that's what saved his life now while he's still here, because they'd been monitoring his prostate. Like I said, we shot that movie from 2012, took us 6 years, came out in 2017. So from 2012 up until my dad's pancreatic cancer diagnosis in like 2019, he'd been fine. The only reason why they ordered an MRI of his prostate is because, your PSA is elevated. Let's check that out. And that's when they found the mass on his pancreas. And so that diagnosis was devastating because that was advanced. They diagnosed him with stage 3 pancreatic cancer and gave him 6 months to live. So that one was like, wait, what? Like, where did this come from, right? Yeah. And that was rough. But again, as a family, he came to us, and that's what was beautiful. He wanted to have a family meeting and share with us. I've been diagnosed with pancreatic cancer. We all went home as a family because we all live in various states. He's in Washington. Everyone lived in a different state. So we all went home and we had a family meeting. And it was Father's Day, so it was perfect. But we were thinking this might be his last Father's Day, and we talked it out as a family of how we were going to deal with all of this.
Yeah. And you mind if I ask you, how's Dad doing?
He is hanging in there. Actually, it wasn't 19 because it was COVID, because that was the other fear of how would COVID affect all of us being there. That was a whole nother thing, because that's around the time of the vaccine and all of that.
Oh, yeah.
So it was 2021 when he was diagnosed. He is still here and he is hanging in there. He's doing pretty well. His cancer numbers are good. He's getting excellent treatment. The immunotherapy has been a blessing because he has good quality of health on top of his treatment. And every day he surprises me. Every day. Yeah.
Awesome. Well, that all started with communication and finding out and sometimes being an advocate for someone when they may not advocate for themselves in some cases. And I want to get into this. Now, this is, I mean, listen, I thought it was masterful how you got a group of pastors to talk about the fear of emasculation.
Mm-hmm.
All right. So there was a group of pastors in the film that were talking about that sometimes Black men specifically can't see themselves without their sexual virility or masculinity. Right.
Mm-hmm.
And so the idea of getting a digital rectal exam, if you don't know what that is, go ahead and Google that. But if you don't know what that is, they won't get checked. And in some cases, not having it, not even taking a PSA test because it might lead to them poking me, could lead to, advanced disease and increased risk of, cancer diagnosis. I go to the doctor. Now, again, I have a Black male doctor, and I was sitting with some buddies of mine, and we were all talking about, our doctors and our health as we do now. And I would consider this group of friends, they were informed.
Mm-hmm.
But even around the table, we're talking about, have you got your prostate checked? And the guy's like, oh, I got mine checked, 2 years ago. He said, I'm good till I'm, however many years. The guy was like, yeah, I got to get mine. I haven't gotten mine done yet. And he was over the age of 50. So even amongst us who are healthy, we consider ourselves knowledgeable, we don't hesitate to engage. We're having this conversation, and I'm thinking to myself, and I told them, I said, my doctor checks my prostate every single year. And I told him, I said, man, are you getting paid a lot of money for that, every year? But Landi, you know what he said to me? He said, you're a Black male. Your risk of developing prostate cancer is almost twice that of any other ethnicity. What if I didn't check it one year? Mm-hmm. And that was a year there was a growth.
Mm-hmm. I
said, okay, I get it. Right. And so now I share my experience with other men. And it was, and I love you so much for this because this was a surprise. We're talking about advocacy and informing, our peers, to have the language, to have the confidence to go in and have these conversations. Mm-hmm. You had Lonzo from the World Class Wrecking Crew. Now, I don't know how many of you out there can feel me right now, but I'm an 80s baby. I'm a child of the hip hop generation. Okay. Lonzo is considered the godfather, the grandfather of West Coast hip hop, birthed Dr. Dre, the birthed NWA and all those things. He was there, and I did not know that he was a prostate cancer survivor, but he said this. He said, you cannot forego your health in pursuit of wealth, because eventually you will forego your wealth in pursuit of health.
Mm-hmm.
That was a mic drop right there.
Yes.
What did you learn from a woman's standpoint? And I know when you go do community events, you hold there's a man cave, and then there's a woman cave, and they talk about from the female perspective how they can support men. Yeah. Talk to us about those conversations and what drives women in this awareness.
Sure. I think women, naturally, we're kind of more in tune to that. We've been raised to talk about, we don't have a hard time talking about our periods with each other or breast exams or any of those things. And, breast cancer or pap smears are all things that we talk about. So we're pretty open when it comes to those things. And so for us, we're usually the ones who are advocating for the men in our lives to go see a doctor, to get their physicals. It's our nature for most of us. And so the reason why I like to separate the women from the men when we do health events is, one, to allow the men to speak freely about their concerns and not feel like they have to sugarcoat their concerns because their significant other or daughter or whoever is there. And for the women to really talk candidly about their fears. A lot of women are frustrated of what it takes to get their man to go to the doctor. Some of the women matter of fact, one of the women on the panel I was on, her husband had breast cancer. Mm-hmm. And trying to get him to go to the doctor when she knew something was wrong. I think he ended up having both prostate and breast cancer. Trying to get him to go was impossible. She had to trick him by telling her she had a doctor's appointment. So she booked one for herself and just asked him to come. But she really had booked the appointment for him because she knew something was wrong. And he refused to go. And so, you know, a lot of that struggle, there was a lot of concern about how do I show my support, right? And let them know, I got you, baby. No matter what, I'm here for you. And then push them to go, and then also respect their fear, right? Because the fear is valid. The fear of erectile dysfunction and the things that are associated with prostate cancer, they're valid fears. But our relationship is stronger than sex. And our intimacy means more to me than the act of actual sexual penetration. And those are conversations that a lot of people aren't willing to have. You know what I mean? Like, I don't even want to talk about it. And so really, we talked about how women can show their support in that and let them know, I'm here for you and I got you, and also respect their space. If you're diagnosed with prostate cancer, and even I struggled with this with my dad, not so much with the prostate cancer, but with the pancreatic cancer, I had to really struggle with first trying to get him to understand that I didn't agree with what his doctors were saying. And I feel like I'm not accepting a 6-month prognosis of your life, but then also giving him the space to make his decision without me hounding him, right? Because as women, we could be like, when we making this appointment? Didn't we have this conversation? What are you waiting for, right? But having to kind of do that balance, because at the end of the day, it is their choice, right? It's their choice, and that can be very hard to accept. So we really talked a lot about balancing the support with the space and how you do that. And it's a tightrope, right? It's a tightrope depending on how open your significant other is about talking about anything. Some men are so closed off, like we talked about, they wouldn't even tell their wife. So one woman, she discovered it by accident because I think it was an email or something she accidentally read and like, oh my God, what are you doing, right? So just kind of really understanding that balance and letting them know that this is important for our family. Yes. This is about our family. This isn't just about you. And I get it's your diagnosis, but this is our family. How can I show you that I love you and I need you here with me? Because this doesn't work without you, right? Like showing that type of love and support, I think is super important.
I know these stories are important. These patient stories are important here on Genetics for Healthcare. We dedicate a lot of our content to sharing patient stories, whether it's firsthand or someone who's a caregiver of someone who's had a diagnosis of not just cancer, but any type of genetic disease that has genetic implications for their care, because you never know where that story will travel and who it would touch. And in listening to Lonzo, who was diagnosed with stage 1 prostate cancer at age 53, he mentioned feeling sorry for himself, why me? And then he came around to saying, hey, people know me. Maybe if it wasn't me, people wouldn't know about this. He took it as a purpose and started being a vocal advocate for men to go to the doctor and get checked. Yeah. And he tells the story that he had posted something on his Facebook page and saw one of his social media friends, someone who followed him. The guy came up to him and said, hey, you don't know me, but I'm this. And but the guy told him, he says, well, I didn't think about getting checked for prostate cancer. Cancer wasn't anywhere on my radar, but it made him go to the doctor and get checked for prostate cancer. He did not have prostate cancer, but in his workup and screening, they caught colon cancer early. Mm-hmm. You just never know. So, one of the takeaways, at least for me, is don't hesitate to talk to your friends, your relatives about your family health history. Talk to your doctor, your care providers, mention it to them, even if they don't mention it to you, because as Ms. Karen Johnson said, do you have a family? Who are you living for? Don't be selfish. And I always ask my guests on the podcast for 3 takeaways, and in this case, for men or women who loves a man, to reduce the number of men diagnosed with cancer. Here's something I found interesting. At the end of the film, after sharing these stories, after having group sessions where your host in the film was trying to inform men, talking about, they had people talking about how the disease affected them. There were still men who were not ready to get the exam.
Yeah. Yeah.
What
Yeah.
are the 3 takeaways for a man or a woman that they can take action to reduce the number of men diagnosed with prostate cancer, or any cancer for that matter?
I think one, like we mentioned, advocating for yourself, educating yourself as much as you can on all these things, not just prostate cancer, but colorectal cancer, because that also affects African Americans disproportionately. Just really educating yourself. And so that way, when you go to your doctor, you can ask educated questions, not just solely relying on your doctor to do that for you. Not assuming that just eating healthy alone is enough to protect you from cancer and other diseases. The only man that we followed that died in our film is the vegan. And it wasn't because he wasn't doing the right things. It was, he had a strong family history of prostate cancer. All his brothers and his father had prostate cancer. There was no way he wasn't getting prostate cancer. Every male in his family had it. But unfortunately, he didn't go to the doctor for 10 years. And so he's the only one to pass away in our film. So knowing that it's more than just eating healthy, there's a lot of factors that go into having cancer. Genetics plays a huge part. And so if you don't know your family history, consider, if you can, consider genetic testing if you're able, and definitely taking care of yourself. But I think the strongest for me is the advocacy. I want to share this quick thing. I know we're almost at time, but my brother's 46, and he went for his physical, and the doctor told him he didn't need a PSA test. And my brother called me from the doctor's office because he's like, "What, are you sure? Well, do I need a digital rectal exam? Like what?" And the doctor's like, "No, we'll wait till you're 50. And he's like, "Well, I know I have a family history. My dad has prostate cancer, and my uncle on my mom's side has prostate cancer. Can you please do this test?" And the doctor's like, "No, you don't need it." So then he calls me. He steps outside the office and calls me. He's like, "Is this right?" And I said, "No, absolutely not. Like, I know they're telling people this now, but at least get a baseline, because you've never had a test, and we know we have a family history, right?" So he's like, "Well, he said I don't need a digital rectal exam." I said, "They are going away from that, but at least get a PSA." The doctor heard him talking to me on the phone and came out and was like, "Who are you talking to?" And he was like, "My sister, she works in health. She's worked in healthcare. She did a documentary. She's very knowledgeable in prostate cancer. And she's telling me," and I'm like, "You tell that doctor," right? And so the doctor's like, "Well, if you really want it, I'll give it to you. I just feel it's unnecessary." This is why I really focus on advocacy and really speaking up for yourself. If I wasn't his sister, he would have just, "Oh, okay. Well, if you say I don't need it, then I don't need it," right?
Yes.
But because of the knowledge that I have in prostate cancer and the awareness my brother had with, this don't feel right, let me at least ask my sister. He was able to get his PSA test. He's fine, but now he knows his numbers. So when he goes back next year, if it's elevated, now we know we need to be concerned, right? And so advocacy, I cannot stress that enough. Just advocate for yourself with your physician. Learn as much as you can so you're not put in a position, because let me tell you something, if he goes back 2 years from now when the doctor thinks he should have it, or 4 years because the doctor was telling him to wait till he's 50, then it's, "Oops, I'm sorry, sir, you have cancer." That's not going to hurt the doctor. It hurts you. So advocacy is the number one takeaway I want people to walk away from this conversation. Advocate for yourself.
Absolutely. When we're in the doctor, they may have 15 minutes with us where I look at that, this is 15 minutes for the rest of my life. Okay.
Exactly.
I don't care what you got going on after these 15 minutes. I'm going to get as much as I can in. And if you can't answer them, come back or give me somebody who can. And that's the type of advocacy that we want to instill, the confidence that we want to instill in people to just go have the conversations and ask the questions so we
Yes.
can reduce the incidence of cancer diagnosis that happen not only in our community, but the world around.
Yes.
Landi Maduro, CEO of Blue Child Entertainment and founder and president of Women of Color Filmmakers. You are a heck of an advocate. Okay, you're writing books. You're starting organizations to help more women get in filmmaking. Okay, what's next for you?
So next for me, a couple of things. On the health side, I am currently raising funds to do another documentary. This time I want to focus on prostate, colorectal, and pancreatic cancer and how those genetically affect Black families. So that one's called The Ties That Bind. So we're raising funds for that right now. And then on the other side, on the educational side, I just launched my academy, Blue Child Academy, which is a film school for indie filmmakers to learn not just cinematic filmmaking, but also how to generate revenue from the films that you create, not beholden to a studio or a streaming platform, but how you can do things like I do. Like I license the documentary out to different organizations to watch it. So kind of sharing that process. And then I have a book called The Ultimate Feature Film Planner, which teaches, it's a 12-month planner, but it's also a workbook. So it kind of teaches you some of the things we teach at Blue Child Academy and in a 12-month book. And that's available on Amazon right now and on my website, landimaduro.com.
That's awesome. Doing the most good. You don't hear too many people in Hollywood that are trying to give back and create opportunities for others. I'm sure there are thousands of them. I'm certain of that. But to hear you and the impact that you're making with this film, and please, The Ties That Bind, once you're there, let us know how we can help our listeners. And please come back and talk about it with us on Genetics for Healthcare.
For sure. Thank you so much. Thank you for having me. I love everything that you're doing. This is a very powerful, powerful show. So thank you.
Awesome. Thank you, Landi Maduro. Thank you for being a guest on Genetics for Healthcare, podcast for patients.